My talk will be on the complications following combined pars plana vitrectomy and Ozurdex implantation. Pars plana vitrectomy is an established and safe surgical approach for the treatment of many retinal conditions. This procedure is, however, not without its complications, mostly because of postoperative inflammation. During PPV, preservative-free triamcinolone acetonide helps in reducing the incidence of postoperative inflammation. However, because of the short life of this drug, it cannot be used long-term. This is where Ozurdex comes into play. It stays in the vitreous cavity for up to 6 months, and it has a similar pharmacokinetic profile in both vitrectomized and non-vitrectomized eyes. Our study was to assess the postoperative complications associated with combined pars plana vitrectomy and intravitreal Ozurdex implantation for a variety of posterior segment pathologies. Our study is a retrospective observational study between October 2021 and May 2022. 25 patients who underwent combined PPV and Ozurdex implantation were taken up. Complications in the intra and postoperative periods up to 3 months were followed. Complications were defined as implant migration into the anterior chamber, worsening of visual acuity by 2 lines or more, increase in intraocular pressure by more than 5 millimeters of mercury from the preoperative baseline. Details of the patients were collected from the electronic medical records. These are our results. 18 of our patients were phakic, whereas 7 were pseudophakic, 2 of which had SFIOL and 1 had iris claw lens. These were the indications of our surgery. Best corrected visual acuity. Preoperative vision ranged from hand movement to 6/24, and there was significant increase in visual acuity 3 months post-op. In 9 patients, intraocular pressure rose to mid-20s and was started on anti-glaucoma medications. They were well controlled, and the medication was tapered 3 months post-op. In 1 patient, the IOP raised to 30 millimeters of mercury. It was also controlled. Central retinal thickness. There was a significant decrease in central retinal thickness by 3 months post-op. However, recurrence of macular edema was noted in 6 patients. Anterior migration of the implant. This was our most important complication, and it was noticed in 2 cases, one with iris claw lens and another with SFIOL, at 2 weeks and 1 month postoperatively. The implant had migrated through the pupillary space between the iris and the IOL. These are the studies that were similar to our studies. In a study done by Zheng et al., findings were similar except that they did not notice any anterior migration of implant. Study done by Kang et al., in 24 eyes studied, there were 4 anterior migration of implant, whereas in our study there was only 2. Khurana et al. Postulated that the absence of lens capsule and prior vitrectomy were risk factors associated with the anterior migration of implant. Our study is not without limitation. One is a small sample size. Second is a selection bias because patients with complicated vitreoretinal pathologies were included, and there was no age and sex match controls. To conclude, combined PPV and Ozurdex implantation, even though a safe procedure in controlling both postoperative inflammation and macular edema due to various pathologies, is not without its complications. The most significant postoperative complication associated with the combined procedure was anterior migration of the implant. Thank you.
Yeah, nice presentation. So, in your own study, in your institution, was there a difference between Ozurdex injection not during vitrectomy, Ozurdex injection in SFIOL or iris claw patients versus combined with vitrectomy? And was there any change in the migration? What I'm asking is vitrectomy has something to do with migration versus the SFIOL iris claw itself is a risk factor? Was there a comparison?
No, sir, it was not compared, except that in a study done by Khurana et al., it was postulated. Because all the patients that we took were vitrectomized patients. So, if we had taken a sample size, like if we had taken controls, maybe with only Ozurdex and then with only pars plana vitrectomy, then we could have come to a conclusion.
What I'm trying to point out is the pseudophakia with PC defect itself is a risk factor.
Yes, sir.
So, in your study, what is it that you are trying to say? Like vitrectomy is the risk factor itself?
No, sir. It is because there is the absence of PC only, because of which the migration can be easier into the anterior chamber.
Thank you.
Yes, sir.